Introduction to Addiction Counseling. Addiction counseling companions play a crucial role in supporting individuals on their path to recovery. This role involves providing empathetic guidance, practical assistance, and consistent encouragement throughout the challenging process of overcoming addiction. Understanding the complexities of addiction and the recovery journey is fundamental to being an effective companion. The companion acts as a bridge, helping individuals navigate treatment, build coping mechanisms, and reintegrate into healthy lifestyles. This introductory section establishes the foundational principles and the significant impact a dedicated companion can have. The scope of the counseling companion extends beyond mere support. It encompasses education, advocacy, and empowerment. Companions help clients identify triggers, develop relapse prevention strategies, and connect with community resources. They often work collaboratively with clinical therapists and other healthcare professionals to ensure a holistic approach to recovery. This course will provide the necessary tools and insights to fulfill this vital and rewarding role effectively. Understanding addiction, a disease model. The disease model of addiction posits that addiction is a chronic, relapsing brain disease characterized by compulsive drug seeking and use, despite harmful consequences. This model emphasizes the biological changes that occur in the brain due to prolonged substance use, affecting areas responsible for reward, motivation, memory, and impulse control. It helps to destigmatize addiction, shifting the perception from a moral failing to a medical condition requiring treatment. Understanding this framework is crucial for companions to approach clients with compassion and evidence-based strategies. Key aspects of the disease model include genetic predispositions, environmental factors, and the progressive nature of the illness. It explains why individuals continue to use substances even when they desire to stop, highlighting the powerful neurochemical alterations that hijack normal brain function. Recognizing addiction as a disease allows for a focus on long-term management, similar to other chronic conditions like diabetes or heart disease. This perspective guides treatment planning and fosters a more supportive recovery environment. Types of addiction. Substance and behavioral addiction manifests in various forms, broadly categorized into substance addictions and behavioral addictions. Substance addictions involve the compulsive use of psychoactive substances, such as alcohol, opioids, stimulants, or cannabis, leading to significant impairment or distress. These substances directly alter brain chemistry, creating physical and psychological dependence. Understanding the specific substance involved is crucial for tailoring effective counseling strategies. Each substance presents unique challenges and withdrawal symptoms. Behavioral addictions, also known as process addictions, involve compulsive engagement in certain behaviors despite negative consequences. Examples include gambling addiction, internet addiction, sex addiction, and compulsive shopping. While these do not involve external substances, they activate similar reward pathways in the brain as substance addictions. Recognizing the patterns and triggers associated with both substance and behavioral addictions is essential for companions to provide targeted support and intervention. Both types require comprehensive and empathetic approaches to recovery. Neurobiology of addiction. Addiction profoundly alters the brain's reward system, primarily involving the neurotransmitter dopamine. When a person uses an addictive substance or engages in a compulsive behavior, dopamine levels surge, creating intense feelings of pleasure. Over time, the brain adapts to these surges, reducing its natural dopamine production and making it less responsive to everyday pleasures. This leads to a need for more of the substance or behavior to achieve the same euphoric effect, a phenomenon known as tolerance. The brain essentially gets rewired, prioritizing the addictive behavior. Beyond the reward system, addiction impacts other critical brain regions, including the prefrontal cortex, which is responsible for executive functions like decision-making, impulse control, and judgment. This impairment explains why individuals with addiction often struggle with making rational choices or resisting cravings, even when aware of the negative consequences. The amygdala, involved in stress and emotional regulation, also becomes dysregulated, contributing to increased anxiety and negative emotional states during withdrawal. Understanding these neurobiological changes provides a scientific basis for treatment and empathy. Psychological aspects of addiction. Addiction is not solely a biological phenomenon. It is deeply intertwined with various psychological factors. Mental health conditions such as depression, anxiety, trauma, and personality disorders often co-occur with addiction, sometimes preceding it as a coping mechanism or developing as a consequence. Individuals may use substances or behaviors to self-medicate uncomfortable emotions, escape painful memories, or manage overwhelming stress. This complex interplay necessitates a dual diagnosis approach, addressing both mental health and addiction concurrently. Recognizing these underlying psychological drivers is critical for effective counseling. Cognitive distortions, such as denial, rationalization, and minimization, are common psychological defense mechanisms in addiction. These thought patterns prevent individuals from acknowledging the severity of their problem and hinder their motivation for change. Low self-esteem, feelings of guilt and shame, and a lack of healthy coping skills also contribute to the perpetuation of addictive cycles. Counseling companions must help clients identify these psychological barriers, challenge distorted thinking, and develop healthier emotional regulation and self-worth. This holistic approach supports sustained recovery. Social and environmental factors significantly influence the development and perpetuation of addiction. Peer pressure, family dynamics, cultural norms, and socioeconomic status can all play a role. Individuals exposed to environments where substance use is normalized or readily available may be at higher risk. Dysfunctional family systems, lack of parental supervision, or a history of abuse can also contribute to vulnerability. Understanding these external influences helps companions identify risk factors and tailor support strategies that address the client's broader living context. Furthermore, societal factors like unemployment, poverty, homelessness, and systemic discrimination can exacerbate addiction. These stresses create chronic feelings of hopelessness and despair, making individuals more susceptible to seeking escape through substances or compulsive behaviors. A supportive social network, access to education and employment opportunities, and a safe living environment are crucial protective factors. Companions must consider these external elements when developing comprehensive recovery plans, advocating for clients, and connecting them with appropriate community resources. Addressing these factors is vital for sustainable recovery. The role of a counseling companion. A counseling companion, often referred to as a recovery coach or peer support specialist, provides non-clinical support and guidance to individuals navigating addiction recovery. This role is distinct from that of a therapist or counselor, focusing more on practical assistance, motivation, and accountability. Companions often have lived experience with addiction, which fosters a unique bond of empathy and understanding with clients. They serve as mentors, advocates, and a consistent source of encouragement, helping clients apply therapeutic strategies in real-world settings. Their primary goal is to empower clients to build a fulfilling life in recovery. Key responsibilities include helping clients develop life skills, set achievable goals, manage daily stresses, and connect with community resources. Companions assist with practical tasks like finding housing, employment, or educational opportunities, and accompany clients to appointments or support group meetings. They also help clients identify and challenge negative thought patterns, develop healthy coping mechanisms, and build a strong support network. The companion's role is to walk alongside the individual, offering unwavering support and guidance without judgment, fostering self-efficacy and long-term sobriety. Ethical considerations in counseling. Ethical practice is paramount for counseling companions, ensuring client safety, trust, and professional integrity. Key ethical principles include confidentiality, informed consent, boundaries, and non-maleficence. Companions must maintain strict confidentiality, protecting client information and privacy at all times, only disclosing information with explicit consent or when legally mandated. Obtaining informed consent means clearly explaining the companion's role, services, and limitations to the client before beginning support. This transparency builds a foundation of trust and respect. Establishing clear professional boundaries is crucial to prevent dual relationships and maintain objectivity. Companions should avoid personal relationships, financial dealings, or any interactions that could compromise their professional role or exploit the client. Non-maleficence dictates that companions must do no harm, always acting in the client's best interest and avoiding any actions that could negatively impact their recovery. Regular supervision and adherence to professional codes of conduct are essential for navigating complex ethical dilemmas and ensuring high-quality, responsible care. Ethical awareness protects both the client and the companion. Active listening and empathy. Active listening is a foundational skill for counseling companions, involving fully concentrating on, understanding, responding to, and remembering what the client is saying. It goes beyond merely hearing words. It requires paying attention to non-verbal cues, tone of voice, and underlying emotions. Techniques include paraphrasing, summarizing, reflecting feelings, and asking open-ended questions. This deep level of engagement communicates respect and validates the client's experiences, fostering a safe space for open communication. Effective active listening builds trust and strengthens the therapeutic alliance. Empathy is the ability to understand and share the feelings of another, putting oneself in their shoes without judgment. For companions, empathy means connecting with the client's struggles, pain, and hopes, even as their experiences differ. It is about conveying genuine care and understanding, helping the client feel heard and accepted. Empathy is not about pity or agreement, but about truly grasping their perspective. Practicing active listening and empathy allows companions to build strong, supportive relationships, which are vital for motivating clients towards positive change and sustained recovery. Building rapport and trust. Building rapport and trust is fundamental to any successful counseling relationship, especially in addiction recovery where clients may have experienced betrayal or judgment. Rapport is a sense of connection and understanding between individuals, characterized by mutual respect and comfort. Companions can establish rapport by being genuine, consistent, and non-judgmental. Sharing appropriate personal experiences, when relevant and helpful, can also foster connection, but always with professional boundaries. A strong rapport makes clients feel safe enough to be vulnerable and open about their struggles. Trust is earned over time through reliability, honesty, and demonstrating a genuine commitment to the client's well-being. Companions must consistently follow through on commitments, maintain confidentiality, and show unwavering support. It is crucial to respect the client's autonomy and choices, even when they differ from the companion's suggestions. A trusting relationship empowers clients to engage more fully in the recovery process, accept guidance, and believe in their own capacity for change. Without trust, even the most skilled interventions will be ineffective. Motivational interviewing techniques. Motivational interviewing (MI) is a client-centered, directive method for enhancing intrinsic motivation to change by exploring and resolving ambivalence. Instead of confronting or persuading, companions use MI to help clients articulate their own reasons for change. Key principles include expressing empathy, developing discrepancy, rolling with resistance, and supporting self-efficacy. Expressing empathy involves understanding the client's perspective without judgment, while developing discrepancy highlights the gap between current behavior and personal values or goals. This gentle approach empowers clients to find their own path to recovery. Rolling with resistance means avoiding arguments and instead inviting the client to explore their resistance, viewing it as a natural part of the change process. Supporting self-efficacy involves strengthening the client's belief in their ability to succeed, celebrating small victories, and focusing on their strengths. MI techniques include asking open-ended questions, affirming strengths, reflective listening, and summarizing. By employing MI, companions can effectively guide clients to discover and commit to their own recovery goals, fostering a collaborative and empowering relationship rather than a confrontational one. Goal setting and action planning. Effective goal setting and action planning are critical components of the recovery process, providing direction and a sense of accomplishment. Companions help clients establish SMART goals: specific, measurable, achievable, relevant, and time-bound. These goals can range from immediate objectives, like attending a support group meeting, to long-term aspirations, such as securing stable employment or rebuilding relationships. Breaking down large goals into smaller, manageable steps makes the recovery journey less daunting and increases the likelihood of success. This structured approach empowers clients to take ownership of their progress. Action planning involves identifying the specific steps, resources, and potential barriers related to each goal. Companions work with clients to brainstorm strategies for overcoming obstacles and developing contingency plans. This process also includes identifying and leveraging the client's strengths and support systems. Regularly reviewing progress, celebrating achievements, and adjusting plans as needed are essential for maintaining momentum and adapting to challenges. Goal setting and action planning transform abstract desires into concrete, actionable steps, fostering self-efficacy and sustained motivation throughout recovery. Crisis intervention strategies. Counseling companions must be prepared to respond effectively to crisis situations, which can arise unexpectedly during the recovery process. Crises might include acute cravings, relapse, suicidal ideation, or severe emotional distress. The primary goal of crisis intervention is to ensure immediate safety, de-escalate the situation, and connect the client with appropriate professional help. Companions are not therapists, but their presence and initial response can be life-saving. Remaining calm, empathetic, and clear-headed is paramount in these high-stress moments. Key strategies involve active listening to understand the immediate concern, validating the client's feelings, and offering practical support. This might include helping the client develop a safety plan, identifying triggers, or contacting emergency services or a mental health professional. It is crucial for companions to know their limitations and when to refer to specialists. Post-crisis, companions can help clients process the event, learn from it, and reinforce coping mechanisms. Training in basic first aid, mental health first aid, and suicide prevention is highly recommended for all companions. Communication skills for companions. Effective communication is the cornerstone of a successful counseling companion relationship. Beyond active listening, companions must master clear, concise, and empathetic verbal and nonverbal communication. This involves using I statements to express observations or feelings without judgment, asking clarifying questions, and providing constructive feedback. The tone of voice, body language, and facial expressions must consistently convey warmth, acceptance, and respect. Good communication fosters an environment where clients feel safe to express themselves authentically and openly. Nonverbal cues are particularly powerful. Maintaining appropriate eye contact, an open posture, and mirroring, subtly matching a client's body language, can build rapport and convey understanding. Companions should also be mindful of cultural differences in communication styles to avoid misunderstandings. Practicing reflective statements, where the companion rephrases what the client has said to confirm understanding, is also vital. Strong communication skills enable companions to effectively convey support, set boundaries, and guide clients through challenging discussions, ultimately strengthening the recovery process. Managing difficult conversations. Counseling companions will inevitably encounter difficult conversations, such as addressing relapse, confronting denial, or discussing sensitive personal issues. Approaching these conversations with preparation, empathy, and a non-judgmental stance is crucial. It is important to choose an appropriate time and setting, ensuring privacy and minimizing distractions. Starting with an affirmation of the client's efforts or strengths can help soften the initial impact of challenging feedback. Framing the conversation around shared goals and the client's well-being can also make it more productive. During difficult conversations, companions should focus on specific behaviors rather than character judgments, using I statements to express concerns. Active listening remains vital, allowing the client to express their perspective and feelings without interruption. Be prepared for emotional responses, including anger, defensiveness, or sadness, and respond with patience and validation. If the conversation becomes too intense or unproductive, it is acceptable to suggest a pause or reschedule. The goal is to maintain the therapeutic relationship while addressing critical issues, always prioritizing the client's safety and progress. Seeking supervision for guidance on particularly challenging situations is also advisable. Self-care for the companion. Working as a counseling companion for addiction can be emotionally demanding and challenging, making self-care an essential practice. Companions are exposed to clients' trauma, struggles, and relapses, which can lead to compassion fatigue, burnout, or secondary trauma. Prioritizing self-care is not selfish. It is a professional imperative that ensures the companion's well-being and their continued ability to provide effective support. Neglecting self-care can impair judgment, reduce empathy, and ultimately harm both the companion and the client. It is a critical component of sustainable practice. Effective self-care strategies include maintaining a healthy work-life balance, engaging in regular physical activity, practicing mindfulness or meditation, and nurturing personal relationships. Seeking supervision or peer support is also vital for processing difficult experiences and receiving professional guidance. Companions should establish clear boundaries between their professional and personal lives, avoiding over-involvement or taking on too much responsibility. Recognizing the signs of burnout and taking proactive steps to address them ensures long-term effectiveness and prevents emotional exhaustion. A well-cared-for companion is a better companion. Overview of treatment modalities. Addiction treatment encompasses a wide range of modalities designed to address the complex nature of the disease. These include inpatient residential programs, outpatient programs, partial hospitalization programs, and medication-assisted treatment, MAT. Inpatient programs offer intensive, structured care in a supervised environment, ideal for severe addictions or those with co-occurring disorders. Outpatient programs provide flexibility, allowing individuals to live at home while attending therapy sessions and support groups. Understanding these options helps companions guide clients towards the most appropriate level of care. Beyond structured programs, various therapeutic approaches form the backbone of treatment. These include cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, family therapy, and motivational enhancement therapy. Each modality offers unique tools and strategies for addressing different aspects of addiction, from changing thought patterns to improving interpersonal relationships. Companions should be familiar with the general principles of these modalities to reinforce therapeutic concepts and support clients in their chosen treatment path. A comprehensive approach often involves a combination of these methods, tailored to individual needs. Cognitive behavioral therapy, CBT principles. Cognitive behavioral therapy, CBT, is a widely used and highly effective therapeutic approach in addiction treatment. Its core principle is that thoughts, feelings, and behaviors are interconnected, and by changing negative or distorted thought patterns, individuals can change their emotional responses and behaviors. In addiction, CBT helps clients identify triggers, challenge irrational beliefs about substance use, and develop healthier coping mechanisms. It is a structured, goal-oriented therapy that focuses on present-day problems and practical solutions. CBT techniques often involve self-monitoring, where clients track their thoughts, feelings, and urges related to substance use. They learn to identify automatic thoughts and cognitive distortions that fuel addictive behaviors. Companions can reinforce CBT principles by helping clients practice these skills in real-world situations, such as identifying high-risk situations and rehearsing alternative responses. The goal is to equip clients with the tools to manage cravings, prevent relapse, and develop a more positive and realistic outlook on their recovery journey. CBT empowers clients to become their own therapists. Dialectical Behavior Therapy (DBT) Basics. Dialectical behavior therapy (DBT) is an evidence-based therapy initially developed for individuals with borderline personality disorder, but now widely adapted for addiction, particularly when co-occurring with emotional dysregulation or trauma. DBT emphasizes a balance between acceptance and change, helping clients accept their current reality while simultaneously working towards positive transformation. It teaches skills in 4 key areas: mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. This comprehensive approach addresses the intense emotional and behavioral challenges often associated with addiction. Companions can support clients in practicing DBT skills by reinforcing mindfulness techniques, such as observing thoughts and feelings without judgment, and distress tolerance strategies, like self-soothing or distracting from urges. They also assist with emotion regulation, helping clients identify and manage intense emotions, and interpersonal effectiveness, improving communication and relationship skills. DBT provides practical tools for navigating difficult situations and building a life worth living, reducing reliance on addictive behaviors as coping mechanisms. The companion's role is to encourage consistent practice and application of these life-changing skills. Group therapy and support groups. Group therapy and support groups are invaluable components of addiction recovery, offering a sense of community, shared experience, and mutual support. Group therapy, led by a trained therapist, provides a structured environment for clients to explore issues, learn coping skills, and receive feedback from peers. Support groups, like Alcoholics Anonymous, AA, or Narcotics Anonymous, NA, are peer-led and focus on the 12-step philosophy, offering a safe space for individuals to share their struggles and triumphs. Both formats reduce feelings of isolation and foster a sense of belonging. The benefits of group settings include the opportunity to learn from others' experiences, practice new social skills, and develop a strong support network. Clients realize they are not alone in their struggles, which can be profoundly validating and motivating. Companions can encourage clients to attend and actively participate in these groups, helping them overcome initial anxieties and find a group that resonates with them. Reinforcing the principles learned in groups and discussing insights gained can further enhance the client's recovery journey. Group involvement is a powerful antidote to the isolation often experienced in addiction. Family involvement in recovery. Family involvement is a critical, yet often complex, aspect of addiction recovery. Addiction impacts the entire family system, and family members often experience their own trauma, stress, and enabling behaviors. Engaging families in the recovery process can provide crucial support for the client and facilitate healing for all involved. Family therapy sessions, educational programs, and support groups like Al-Anon or Nar-Anon help family members understand addiction, set healthy boundaries, and develop their own coping strategies. Companions can encourage clients to explore family involvement when appropriate and safe. The goal of family involvement is to create a supportive and healthy home environment that fosters long-term recovery. This may involve addressing communication breakdowns, resolving conflicts, and establishing new patterns of interaction. Companions can help clients communicate their needs to family members and guide families towards resources that help them heal from the effects of addiction. It is important to recognize that not all family relationships are healthy or safe, and the client's well-being must always be prioritized. When family involvement is positive, it significantly strengthens the foundation for sustained sobriety. Relapse prevention strategies. Relapse is a common, though not inevitable, part of the recovery process, and effective relapse prevention strategies are crucial for long-term sobriety. Relapse prevention involves identifying high-risk situations, developing coping skills to manage cravings and triggers, and creating a comprehensive plan for what to do if a slip occurs. It is important to view a slip not as a failure, but as a learning opportunity to adjust strategies. Companions help clients understand the stages of relapse, from emotional and mental to physical, allowing for early intervention. Key strategies include developing a strong support network, practicing stress management techniques, engaging in healthy leisure activities, and avoiding people, places, and things associated with past substance use. Clients also learn to identify warning signs, such as changes in mood or behavior, and implement immediate coping strategies. Companions assist in creating a detailed relapse prevention plan, including emergency contacts and steps to take if a craving becomes overwhelming. Reinforcing self-efficacy and reminding clients of their strengths are vital in building resilience against relapse. Aftercare planning and long-term support. Aftercare planning is a crucial phase of recovery, focusing on maintaining sobriety and building a fulfilling life post-treatment. It involves developing a comprehensive, individualized plan that outlines ongoing support, resources, and strategies for long-term well-being. This plan typically includes continued engagement in support groups, regular check-ins with a companion or therapist, vocational training, educational pursuits, and healthy leisure activities. The transition from intensive treatment to independent living requires careful planning and consistent support to prevent relapse. Companions play a vital role in helping clients create and adhere to their aftercare plans. This includes connecting clients with community resources, such as sober living environments, employment services, and educational opportunities. They also help clients identify and cultivate new hobbies and interests that align with a sober lifestyle, fostering a sense of purpose and joy. Long-term support emphasizes building a strong foundation for sustained recovery. Addressing potential challenges and celebrating milestones. The goal is not just abstinence, but a life of meaning, connection, and personal growth, supported by a robust aftercare framework. Co-occurring disorders, dual diagnosis. Co-occurring disorders, also known as dual diagnosis, refer to the presence of both a mental health disorder and a substance use disorder in the same individual. This is a highly prevalent and complex challenge in addiction recovery, as each condition can exacerbate the other. Examples include depression and alcohol use disorder, anxiety and opioid addiction, or PTSD and stimulant use. Treating only one disorder often leads to poor outcomes, as the untreated condition can trigger relapse or worsen symptoms of the other. A holistic, integrated approach is essential for effective recovery. Companions must be aware of the signs and symptoms of common mental health disorders and understand how they interact with addiction. While companions do not diagnose or provide clinical mental health treatment, they play a crucial role in identifying potential co-occurring issues and advocating for integrated care. This involves encouraging clients to seek professional mental health evaluations and connecting them with specialists who can provide concurrent treatment. Supporting clients in managing both conditions simultaneously requires patience, empathy, and a collaborative approach with clinical teams, ensuring that both aspects of their dual diagnosis receive appropriate attention. Addiction in specific populations. Addiction manifests differently and requires tailored approaches in various specific populations. For adolescents, factors like peer pressure, developing brains, and family dynamics are particularly influential, necessitating family-centered and developmentally appropriate interventions. Older adults may face unique challenges such as polypharmacy, social isolation, and age-related health issues, requiring specialized medical and social support. Understanding these demographic nuances is crucial for effective and sensitive counseling. Other specific populations include pregnant individuals, veterans, LGBTQ+ individuals, and those within the criminal justice system. Pregnant individuals require immediate, non-judgmental care focused on maternal and fetal health. Veterans often struggle with trauma-related addiction, necessitating trauma-informed care. LGBTQ+ individuals may face stigma and discrimination, requiring culturally competent and affirming support. Those in the criminal justice system need integrated treatment that addresses both addiction and legal issues. Companions must be aware of these unique needs and advocate for specialized resources to ensure equitable and effective recovery support. Professional development and supervision. Ongoing professional development and regular supervision are indispensable for counseling companions to maintain competence, prevent burnout, and continually enhance their skills. The field of addiction recovery is constantly evolving, with new research, therapeutic approaches, and ethical considerations emerging. Engaging in continuing education, workshops, and conferences ensures companions stay informed and can provide the most effective evidence-based support. This commitment to lifelong learning reflects a dedication to professional excellence and client well-being. Supervision provides a structured opportunity for companions to discuss challenging cases, process emotional experiences, receive constructive feedback, and address ethical dilemmas with an experienced professional. It offers a safe space for reflection and growth, preventing isolation and reinforcing best practices. Regular supervision helps companions maintain objectivity, manage countertransference, and ensure they are working within their scope of practice. Investing in professional development and supervision is not just a requirement, it is a vital investment in the companion's own health, effectiveness, and the quality of care they provide to individuals in recovery.